Dr. Grigsby, you're on mute if you're talking to us.
Dr. Griggs, are you talking to us, Dr. Grigsby?
Yes, but I'm muted. Sorry.
I
It's
couldn't tell if maybe somebody was in your office or
I was
something.
just like, I apologize. I was trying to take care of a patient issue, but it's taken care of now. So I apologize. Welcome to everyone. I'm sorry that I was talking to you without any sound, which sometimes is best for me, but
I was
let's
actually
go.
asking you if you were talking to us with sound, without sound myself. So
Oh, welcome everyone. If you are from one of the MCOs or are our guest, please put your name and credentials information in the chat. I feel like we have a new member, but I don't know if that new member is with us. So, Erin, are you here?
Out today. I have been out myself, so I will look into that and let you know.
Um, I can't hear. There's something going on with our Zoom today.
Can you hear me
We're
now?
all muted or something.
Can you hear me now? This is Kelly.
Thank you all for being here. I cannot hear if someone from Kentucky Medicaid is trying to speak. The box lights up, but I can't hear anything. Can you guys hear?
Hi, this is Kelly Sheets. Can you hear me now?
just a little bit.
Okay.
Let me try opening my laptop. Does that help?
Yeah, you're pretty soft. So,
Okay, well, I don't have much of a voice.
okay. I'm sorry.
No, it's okay. I'll try very hard to speak louder, as loud as I can.
Okay.
Um, Erin is out today, so I'm your host for the day.
Okay.
And we are at 2:03, so if you want to go ahead and get started, we can.
Okay.
I have four members, I believe. Um, if there are any others on that I did not get, if you would please let me know. I have Donna Grigsby, Natalie Crawford, Courtney Smith, and Sherry Dimar.
Okay. And Natalie, have you been with us before?
No, ma'am. Today is my first meeting.
Okay.
I am our new Family Resource Youth Service Center Coalition representative.
Okay. Well, welcome. Natalie, I'm Donna Grigsby. I'm a pediatrician at UK and I'm representing the Kentucky chapter of the American Academy of Pediatrics. And Sherry and Courtney, if you would introduce yourselves as well.
I'm Sherry Dimer. I'm with the Kentucky Parent Teacher Association.
I'm Courtney Smith. I represent the Kentucky Psychological Association.
All right. Well, welcome, Natalie. We're glad to have you join us. Four members establishes a quorum. Is that correct?
That is correct, yes.
Okay. So now that we've established a quorum, can I have a motion did everyone have a chance to look at the minutes from last meeting? And can I have someone move to approve the minutes?
I move to approve the minutes from the last meeting.
Okay. And do I have a second?
I'll second it.
Okay. All in favor? Aye. Okay. All right. We're going to move on to old business. Update on school-based services. We were looking for information on payment for services outside of school hours. Do we have someone that will update us on that?
Can you hear me?
Yes, thank you.
I'm sorry, I was having a moment trying to get off of get it off mute. Let's see. We did have a meeting with PCG, and that his name was Peter. He created a PowerPoint and stuff. So I will put that in there. The link so everybody can go and watch it. It's about 30 minutes. That's about it. But he was telling the pros and the cons for the trying to do it outside of school hours and everything. So there's kind of a lot that it's not that it's impossible, because it is possible, but there's a lot more to it that will ultimately be the responsibility of the whole state versus just one or two counties that may or may not want to do just a couple of after-hour clinics or something. So, but as far as that goes, that's something that KDE and DMS would have to, come together and kind of get worked out. Let me see here. And I just put the link in the chat.
And I will send that link out by email after the meeting.
Okay.
Do you have any questions?
So let me just make sure I understood what you said. So it's something that will have to be looked at statewide, not county to county in terms
Right.
of, okay.
Yeah, because of the cost settlement and the random time study, it's not an isolated county that wants it. It has to be, and that's sometimes what can cause the state to actually not get back all the funds by doing that. So that's something KDE is going to have to do. Now, if you do come across and you're watching the video, then and you have any questions, please feel free to go ahead and send those to me, and I will get those to Peter so that he can get those answered for you.
Okay, thank you. Any questions or comments? Okay. The next item agenda under old business is oral health emergency care and OR delays. Excuse me. But I don't know if we have anyone here that's prepared to talk about this.
Hey, this is Carrie at Molina. I have a brief update that I can give to you from the Molina view. I'm working with our partner DentaQuest, and we have continued to hear there are challenges, with providers getting OR services, and we are looking at alternative options to help with sedation. Some of the groups are actually contracting with us on the medical side, like such as Mortensen, to be able to perform sedation in their offices. And we also have a partnership with Smile MD. We are expanding in 2025.
Okay.
Hello, this is Dr. Caudle.
Yes.
This is Dr. Caudle, Vice President for Avisus and also the Kentucky State Dental Director. Similar to Molina, the three plans that we're administering, which is Humana, WellCare, and Aetna, we've also been contracting with SmileMD for the past 4 years, expanding access to care because a lot of our pediatric dentists were being frozen out of the ORs for from what I was told, more lucrative procedures. And so that's when I reached out to SmileMD and brought them into Kentucky. And they had some rough spots. They've now got new leadership and are expanding their services, not just Central Kentucky, but in more locations. And there's also 2 additional services that are offering office anesthesia And now these are primarily for ASA 1 and ASA 2 kids. Any kids sicker than that still need to go to the OR.
Okay. Any other updates from any other provider groups or MCOs? So Dr. Cottle, are you telling us that this continues to be an ongoing issue?
I'm still hearing it's some.
Okay.
Now, I understood that there were some new federal guidelines to increase compensation to hospital ORs and their departments for dental procedures. I'm not sure if that has taken place yet, though, or if the word has filtered down where they're opening up more slots. But it has been a real problem for several years.
Okay. Well, and perhaps this is something that we bring to I can't imagine it's not been brought to the attention of the MAC. Do you know if the MAC is aware of this issue as well?
I know the dental TAC is.
Okay.
I don't know if
I
they've
don't know
taken
if
it to the MAC
it's,
or not.
yeah, I don't know if it's someone, if someone from the dental TAC has brought it to the MAC, but certainly we could, you know, bring that to as a recommendation to the MAC that they, or certainly let them know that we have concerns about what we're hearing about these OR delays for dental procedures for children.
And it seems to me more geographic, individual hospitals, and they have their own individual contracts on the medical side with MCOs, but we're finding it some areas there's not a backlog and not a delay, and others there's a very large delay.
Okay. And do we know what those specific areas are, or is that something we need to just reach out to the dental tech about? I just think it would be nice if we both kind of put our concerns forward to the MAC.
I mean, I could take a poll of our pediatric providers and get a sense, of which geographic areas are struggling, and maybe get that back to you. I'm actually at a Primary Care Association meeting in Lexington right now, though.
Oh, okay, sure. If you wouldn't mind doing that, obviously we've been discussing this for a bit, so it's not urgent that we have to have the information immediately. But it certainly would be something that I think would be nice for us to reach out in collaboration with our dental colleagues from the dental TAC to say, hey, this is an ongoing issue in certain areas, and we just want to make folks aware of it.
Well, bringing in the outside anesthesia groups, which usually consists of an MD anesthesiologist and then a registered nurse and a paramedic. And they bring in everything after making sure the facility qualifies as far as facilities and space for a gurney and an emergency and all the things in a separate recovery area. That has alleviated a lot of the pressure, but then we still have areas where they don't go to because there's not enough pediatric offices in the area to justify a team going to that area on a regular basis. So those areas are still struggling, is my understanding. But I'll try to get that information for you.
Okay.
Because when I was in clinical practice in Kentucky, I treated this population. I treated special needs population, but I was licensed also in general anesthesia. So I could do it in the office, or I could take them to the OR in Moorhead or UK.
Okay. All right. Thank you. Thank you for your help with this. We can at least,
Okay.
if there are certain
I'll
areas.
try to get that for you.
Okay, thank you so much. Okay. Any other comments or updates from other MCOs on this issue? Okay. Moving on through the agenda, the next item is information on immunization gaps from school data. I feel like this was a follow-up to a discussion we've had in the past, and that I think they were waiting kind of to get into the school year before we could get new data about the immunization rates that we're seeing.
I have some information. This is Dr. Terrio. I was going to bring you to the school immunization website. Well, I'm going to attempt to do that.
Okay.
So I shall try.
Thank you.
I can't believe I have so many windows open. Oh, here it is. Can you guys see that? Yeah. Okay. This is, and you're right, the information was just updated. This is the Kentucky Environmental Public Health Tracking System, and they do, and it's from our cabinet, and they have a special area on Kentucky immunization schools survey, and it's open to the public, and you can see, let me move this out of the way. They have a little explanation, and you guys are probably smarter than me. When I was looking at it, I was trying to find HPV rates, and I was like, why can't I find those? Well, it's because this is the school immunization tracking. The school doesn't care about HPV. You know, they only report on the things that are required for the school system. And so in the middle of the screen, you can see like when they say, when they look at the DTaP rate, you know, they're saying you're up to date if you've had 4, for example, polio if you've had 3. And so if you go to kindergarten immunizations, you can scroll down, move over a little bit. And if you guys can see that, and you can look, this is for kindergarten, how many of the kids in kindergarten have had 2 Hep A's, for example, and you can look at that over time from a 2018-2019 school year into the 2023-24 school year. And so looking at that, you know, they're all about the same. It is amazing that they're not all the same. So 90% of the kids entering kindergarten have 2 Hep A's. Let's see this one. And 91.7% have 2 or 3 polio vaccinations. So you can kind of look at that. I asked them why this dark blue line at the bottom is all immunizations. And I asked them why that is lower than the individual counts above. And they said it's always going to be like that because people are, you know, hit and miss on having all of your vaccines up to date. So if you just miss 1 Hep A, for example, you're going to knock this total down. So this is the total of all the people that have not, you know, have not been completely immunized for kindergarten. And so our rate right now for this last school year was 84.7. And then you can look and so you can say, okay, what is this one? Click on that. This is religious objections, so that's 2%. And this is an interactive website that you guys can all go to. This one is not up to date with all vaccines, so 10%, 9% of them. And then you can also change and look at what counties. So let's find, is this Fayette? So Fayette County, all vaccines, 88.89%. So that's better than the state average. Some of the counties, Jackson County, 98. 0.65%. So you can see some of the counties are doing better than others. And then this basically says this breaks it down by county. Same thing that you can get from the map, and you can click on it and see, what your overall rate is and what, your individual vaccinations are for that county. So let's see. Go back. Then we go back. Sorry, guys. They keep moving the picture thing out of the way. There we go. So 7th grade immunizations, which is where I goofed up and was looking for HPV. You can see the same sort of thing. The overall immunization rate for last school year was 80%, so worse than kindergarten. Menactra, surprisingly, is the lowest out of the individual vaccinations, which is 83%. And you can, again, at least the religious objections rate dropped to 1.4, 1.5% here. And then when you're looking at kids exiting, getting close to exiting, our rate is 53.89%, which is horrible. So these, because I think pediatricians, I know I'm biased, but we do a really good job of immunizing our kids. And then when they grow up, they're basically lost to follow up, and they're out of our control. But when you're looking at this, Menactra is still low. And keep in mind, this overall immunization rate of the 53.98%, that is not even thinking about HPV. Usually when that's incorporated in it, it's a whole lot worse. So this is your basic Menactra, Tdaps, Hep A's, all of that. So that we have a lot to work on for that. This is the map when you wanted to look at that. And then again, same as before, you can look at the individual county level data. So I want to stop sharing now. I can tell you we're trying to do things. Oh, good. Crystal's here. Hi, Crystal. Crystal Back is here. She's, I think of her as the guru for childhood immunizations in the state. She works in public health. But so we have a lot to do. Our immunizations are going in the wrong direction. And we're working with public health, we're working with our MCOs to try and improve some of these rates. But you can see, with the school system and their record keeping, I think it's worse than I would have imagined. But again, anybody can go to these websites. They're public, they're interactive, and that's all I have for you guys for today.
Dr. Terrio, I know Menactra was the lowest, but is that what's pulling that number down so much? Because it feels like those numbers are in the 80s, unless I'm looking at the thing wrong. But then all of a sudden, when you go to all of them together, it's in the 50% range. So yeah.
It's because that when you look at the kiddos and say who's got all of them, who's got the right number, it's in that 50% range. So somebody might have missed a Hep A or, Menactra or something like that. And, if they're not doing sports, they don't go as often as the little ones. And so you're missing them because they're just not going. And maybe everything was meant to be well, and maybe you were out of one of the shots when they were in, but then they just don't come back for 2 years and they don't think about it.
So it's just a combination of a lot of, it's not just like, oh my gosh, we've got some information, like we've got some education to do on certain vaccines. It's like, it's a little bit of everything.
It is, but it is getting worse. And we don't know why it's getting worse. A lot of people became mistrustful of vaccines during COVID. And that, I mean, I'm just throwing that out there as a possibility that suddenly now people are not, you may have been up to date before, and now you just don't want your kid to get any more vaccines. So maybe they were up to date and just need, a Tdap or something, and the family doesn't feel comfortable getting that last shot. But it's a big problem.
Yeah, and what does the school, like, in terms of the school's responsibility, do they have, I mean, are they reaching out to these families and saying, hey, your child doesn't have the legally required vaccines, or what? Because, I always naively say when patients come into our clinic and we don't, for some reason, we can't find immunizations, I'm like, well, they're in school. Somebody's looking at that. But
I say the same thing. And I also have parents come in and say, October 1st, they gave me until October 1st to get his kindergarten shots done. And now it's October 2nd, and they told me he can't come back until he gets the shots. I mean, I've had moms tell me that, but I don't know. I don't know what's happening. You could see that the rates for the exemptions are very low. I didn't go into it. There was a little sliver on some of those charts, and the little sliver is the medical exemptions, which is like 0.3. I mean, it's very low. And so even that combined with the religious exemptions is a very small percentage of the patients. So I can't explain it at all.
And are we now accepting philosophical exemptions?
That is not in Kentucky
Okay.
law.
That's what I thought, but I'm trying to understand how this, probably as you are, like, how is this happening and why? Yeah. Okay.
It is a great
Thank you.
website if you want to go to it and see.
Okay. Could you send us the link?
Sure.
Okay. Thank you.
I'll send it to Kelly, and then
Yeah, that would be perfect. Okay.
And then I also sent out something on chronic absenteeism. I don't know if you saw that, but Aaron was going to send that out to everybody on the TAC about kids that are chronically absent from schools, which is becoming a huge problem as well.
Okay.
Must be a post-COVID type thing.
Okay. Yeah, you probably seen this too. I have kids come into clinic and they're like, I don't want to go to school. What's happening at school that makes you not want to go to school? Courtney, you probably see this as well. I just don't want to go. I don't want to leave the house. Okay, well, I don't want to leave the house either, but
Well, it's that, and it's, well, why do I have to go to school? Because all I do is work on my computer or on my tablet when I'm at school. Why can't I do that at home? I can do it in half the time. And, the moms might say, well, you got a point there. Stay home.
Yeah.
And yeah, so it's the chronic absenteeism is a huge problem.
Okay. Well, maybe that's something we need to look at in one of our future agendas is, because I know that it's a bit of a problem. I'm sure I don't know the extent to which it's become a problem. And that may be helpful for us to know.
Okay, I can send you some contact information now.
Okay.
And I think it's a lot, easier, and I guess, I don't know, maybe more acceptable. And I don't mean to say anything derogatory about this, but parents can select, homeschool, virtually. Obviously, they can also do it themselves. And I mean, I think the pandemic did wonderful things for us in that regard, and maybe terrible things for us in that regard all at the same time. And I don't know if our, the PTA, Cheryl might have some information about that too. I guess I just feel like a lot of the families we see here are just choosing to do virtual programming that the schools readily provide typically. Now that's in Louisville, that may not be everywhere. Plus, I personally work with a very sick population with no immune system, working just with transplant patients. So that's a whole nother level when you have chronic illness and parents are worried about exposure, even though our doctors say they're fine to go. So it's tricky all the way around.
Oh, yeah. Well, thank you.
Well, if I'm hearing agreement from TAC members, perhaps this is a topic that we can put on our agenda for a future meeting.
I was going to mention in our national PTA news monthly newsletter, one of the big articles is, are parents giving their kids too many mental health days? I mean, there's just a lot of things at play nationally that are maybe causing this to be more of a problem. Mm-hmm. And that was the big issue, the big topic on our last bulletin. But so I would agree that's something we need to probably look at more.
Okay. Thank you. And thank you, Dr. Terrio, for bringing that to our attention. All right. Any other questions, concerns, information on immunization gaps? Okay. I think, and I just need to check with Kelly about this, but I feel like under new business, there was an additional agenda item that was added to an email we received. But I'm just, and I don't know if we're allowed to discuss it if it wasn't published.
Yeah.
But it was on ACOs.
I'm afraid I'm not aware of that.
It was the first item listed on the new agenda under new business, but I don't know if that was published, you know, as the updated agenda or not. And I feel like the rules are we have to have it in the published agenda before we can discuss it. Is that correct?
That is correct.
Okay.
So maybe that just needs to get moved to the next agenda, the next meeting agenda.
I'm sorry, Kelly, I couldn't hear that. I'm sorry.
Don't apologize. It's all me and my voice, and I'm so sorry. But yes, if you want to push that to the next meeting agenda, that would probably be best because I'm unaware of it.
Okay. Okay. So just to let the folks on the meeting know, there were several questions raised about ACOs. And so we will put that forward as new business for our next meeting. It also looks like we're discussing Medicaid services for incarcerated youth in the January meeting. And then the third new business item is the 2025 meeting schedule. So TAC members, MCO members as well. Do we feel like that quarterly meetings allow us to discuss what we need to discuss? We previously had meetings every other month, and then this year we went to quarterly meetings. And I feel like our agendas haven't been overly full. So my thought is that it would be appropriate to continue to be on quarterly meetings, but I'm open to discussion and suggestions from others.
I agree with you, Dr. Grigsby, that it feels like it's been enough. I am open to other thoughts. I mean, I think when we met every other month, we were getting off within an hour, often, sometimes less than that. Even when we had pretty dense presentations, it felt like, or, you know, when our agenda was fairly full. That's my 2 cents, but I'm open to doing them every other month, whatever we need, whatever everyone thinks we need.
Mm-hmm.
I agree. It seems like we're able to cover the information that we want to get done and not, you know, be done like an hour early. So I think the time amount seems appropriate.
Okay. All right. Any thoughts from our Medicaid colleagues or our MCO colleagues? Is everyone comfortable that there aren't big issues arising between our meetings?
This is
Okay.
Stuart on with Well Care. I was going to say we're here to serve at your pleasure, the MCOs.
Thank you.
So whatever you prefer.
Okay.
And this is the other Stewart from Anthem. We're the same boat. We'll support as appropriate, and quarterly sounds good.
Okay. I appreciate that. So, given that we are typically the second Wednesday, our meetings next year then would fall in January, April. Let's see if Grigsby can come up with this, July and October. Is that correct? Does that sound good to everyone? The one meeting I have some concern about is the April meeting because Easter and spring break are late. So that may be something, obviously not necessarily. I think next year Easter falls late, which means spring break falls late as well. So our meeting would be April the 9th. Let me see. And I feel like, oh, actually, yeah. I mean, again, we can talk about this later. Because obviously if everybody is off on spring break that week, we probably need to think about a different week.
Yeah, Easter's on the 20th, but I believe JCPS here in Louisville has spring break that first week of April, I believe. Or it could be the last week of March. I could look really quickly, but
yeah,
I'm sure
let me look
everyone
really quickly at
I can look real quick too.
Okay. I will look at Fayette County as well. Not because I'm going to be gone, but because I'm typically covering clinic a lot during that week. As one of the old folks who doesn't have children in school.
What I'm seeing for JCPS and the biggest, the bigger district in Louisville is the first, wait, let's see. I wonder why it doesn't. Oh yeah. It's March 31st through the 4th. So
not an issue. Yeah. Let me look at. It looks like it does look like it's that week for Fayette County, the 7th through
so it counts Easter for yours.
Yeah.
Ours is the week before. Well, Easter's not till the 20th though.
Yeah, I'm not sure. Yeah, spring break is that week. So we may want to think, since we're 6 months ahead, we may want to think about doing that. And I don't know if Jefferson County spring break affects a lot of folks. I just know that I'm typically in clinic on Wednesday afternoons, and I'm certainly in clinic when it's spring break week. So that would be the 9th. But we can talk about that.
Okay.
Okay.
Are we allowed to choose a different Wednesday?
That's what I need to check.
Okay.
If you can move the meeting, that's perfectly fine. But I would have to, Aaron and or I would have to check with our schedule because we have 16 other TACs and the MAC.
Right.
We would have to check.
Right.
Okay. So should we put that on our agenda for the next, for the maybe we should put that on the agenda for the January meeting then?
Yeah.
To choose an April date that works.
Okay. Okay. And then under general discussion, future topic suggestions. We have a topic for January. We've talked about preventive care for adolescents and bullying. And now we're talking about absenteeism, which I would like to see us, depending on how long we feel the discussion for the January meeting would take, particularly since we're talking about, there are questions about ACOs as well. So perhaps, I don't know if we want to try talking about absenteeism in January as well, versus April. It depends on how full we think the agenda is going to get. So I don't think, and let me ask you this, Dr. Terrio, you may know the answer to this. For it, will we need reports from each MCO about the services for incarcerated youth, or is that a Medicaid specific, not necessarily the MCOs for incarcerated youth?
Yeah, that would be for Medicaid.
Okay. So we probably would be able to add the information, the report on absenteeism, that same meeting.
Sounds good.
Are there any other suggestions for topics? Future topics? Are there any? Oh, okay. I'm just looking at the message in the chat. Okay. So that's the children's TAC page. Okay. Thank you. Are there any updates from the MCOs? I know sometimes we usually ask if there are any updates or anything that any of the organizations need to share or anything the MCOs need to share. So any updates from our TAC members from their organizations?
This is Stuart with WellCare. Stuart on with WellCare. I'll just mention as far as the immunizations, we all partnered together. Just a little news. The MCOs through our association at the state fair to we had a vaccines that we immunizations that we offered. We gave out a 30, I believe it was like the free admission to the rides. I think it was like $30 value. And total, this is not just children, this would be anybody. But I think we topped almost hit 2,000 people that were immunized during the state fair. That was just, again, all the MCOs partnering together through our association, had a booth at the fair. And we partnered with Walgreens, which was wonderful because they were there every day to do the vaccine. So just thought I'd share that news.
That's a wonderful way to get immunizations to the public. I'm not sure I would have really enjoyed going to the fair and getting a shot, but that was just me as a kid. But how nice for the parents that you can that was an option.
I was just gonna say that. Come on, kids, let's go to the park. Let's go to oh, by the way, you're getting a shot.
Whoops. Whoops, sorry. You gotta have a shot before you get on the rides.
There's a catch to everything.
No, see, I would have been the kid that just left because I'd have been like, I'm not getting a shot. I'm going home. Yeah. That's awesome though. That's a great way to reach out to folks. I love that. As a kid, I wouldn't have loved that, but as an adult who advocates for easy access to vaccines, I love that you guys did that. So, and there's a question in the chat, which vaccinations were given?
So it was flu, for certain. WellCare actually we had some additional vaccines. The one that the association that we all partnered together on, for certain, was the flu. May have included COVID. I definitely know it was the flu. But then WellCare, we were next to it. We offered some more, like including HPV. There was about 8 or 9 different vaccines that WellCare offered as well. But the association, we all came together for the flu. And, this was in middle of August. So that's kind of a challenge. People are like, oh, it's too early, but it really isn't. And it, just as comparison, it was, I think a couple of years ago, maybe 900. So it was I forget the exact number. It was very close to 2,000, maybe even over 2,000.
Okay, wonderful. And here is a follow-up question to that, Stuart. I'm sorry, I apologize.
No problem.
Was there a way to get that? Were those all entered into the immunization registry?
Yes.
Okay.
Great question. Walgreens handled that. All of it was entered and documented in the registry as well.
Wonderful. That's
Mhm.
great news.
Yeah, and again, I mean, Walgreens really was wonderful. I was there for one day, and they were super friendly and helpful. They were a great partner in doing this.
That's wonderful. And from someone who was practicing before the registry and after the registry, it is one of the best things we have done in this state, I'm going to say. It's been amazing that we've been able to not have to re-immunize children who have already been immunized. So, all right. Any other updates from the MCOs or other organizations? Okay. So today is the immunization summit. Many of the MCOs have sponsored and are attending, which is wonderful. Okay. So moving through the agenda recommendations, I think certainly we will share our concern about what we're hearing about OR delays, but perhaps we will save that when we have data about specific areas that are certainly more significantly affected. Okay. MAC meeting representation, again, still on Thursdays, I believe. Is that correct, Kelly?
Yes, ma'am, that is correct.
Okay. And I feel like, and which Thursday is that?
Hold on, let me look real quick. I'm sorry.
Okay. For those of you that are new, the MAC meets on Thursdays. Both Dr. Smith and I have clinical commitments those days, so it's difficult for us to go to those meetings as representatives.
It's the fourth Thursday of the month. So
The fourth Thursday of the month?
Yeah, of every other month, yes.
Every other month, okay.
So the next one would be on November 21st.
November 21st, okay. Okay. So perhaps we'll send out an email to see if anybody would be available to join. Okay. Any other questions? We are going to get the gift of a lot of time today, guys. Unless someone has anything else we need to discuss. And could the members of the TAC stay on so we can work on January's agenda? Do I have a motion to adjourn?
I motion for us to adjourn.
Okay, and a second?
A second.
Okay. All in favor? Aye. Okay. If you all would stay on and Kelly, if you would stay on, we will work on. Thank you all for coming. We're giving you the gift of an hour and 10 minutes, an hour and 10. I was trying to go slowly and be thorough, and we just went very quickly today. So we were very efficient. So thank you all for being here.
Thank you. Have a great rest of the day.
And we will see you all in January.